My story today actually begins with the entity that defines Assam. And it starts a little distance away from here, but the entity is, as you guessed, the Brahmaputra River, which flanks this great institution and the great city of Guwahati. I think that one of the things that I wanted to say to you is that all of you must have seen the Brahmaputra, obviously. You've traveled on it, you've probably had conversations about it, listened to Bhupen Hazarika, and you've probably romanced by it, seen the sunrises and the sunsets. But our story is slightly different. It begins on a boat on a day like this in Majuli, the island at the heart of the river in Jorhat district. And Jahanu Borua, the filmmaker, and I, we are on a ferry. The story was very simple. It was about a young woman. Picture this, a young woman, pregnant, on a ferry, or wanting to reach a ferry to go to a hospital. She and her family come to the ghat on the Majuli side, Kamlabari Ghat, but they reach late. It's been a painful and difficult pregnancy for this young girl. They have to spend the night outside in a chilly January night, like last night, damp and cold on the banks of the river. There's no shelter. The next morning they make the ferry, but it's too late for the girl. She doesn't survive the journey. So when we heard this, we were very, very deeply distressed. So the story begins with that episode on the boat in Majuli. Jahan and I were very upset, and we thought about this, and I started researching it. And we came up with some terrible data about the region. We always talk about ourselves in Assam as respecting women, giving them dignity, space. But you look at the facts and they tell you a different story. Assam has the worst maternal mortality ratio in India. At that time, it was nearly 500 per lakh live births. That means it's more risky for a young woman to be pregnant in a rural area and expect to deliver without access to basic health care, without access to safe delivery. I also found out that there are 2,500 islands on the Brahmaputra. I didn't know that, where 1/10 of the population of our state live. And many of them are without the facilities that we all expect as normal. We know, lights, camera, action, roads, regular food, markets, schools, health care. None of this, or very little of it, is available. So I was wrestling with this, and we thought about what is it that can be done? What's the idea that can change things? All of us feel it's important to do something in quotes, to make a change. So I said, we have to reach this group who have faced a double whammy. I mean that they're suffering from geographical exclusion and social exclusion. The communities have that problem. And it's extremely difficult to reach them. So the problem of access is the core problem. So what can change things? And it was very simple. The services should go to people instead of the other way around. This young woman died because she went in search of a service that was not available, that should have been available to her. How do you do that? You can't build bridges everywhere. You can't build roads. You can't have helicopters landing on islands. So you use the oldest technology in the book on the river, which is boats. But you tweak them, you redesign them, you build them so that they can provide health care. They have people on board who can provide that special assistance to women, children, and adults in distress or in need. And that's what we did. We participated 12 years ago in a World Bank event called the India Development Marketplace. We designed this idea, a ship of hope in a valley of flood. We won a small award, and that's the first ship. It's called Aha in Assamese, or Asha in Hindi, which means hope. But there were very, very major key challenges. When we started with one boat and one district and a very small team, which is a temporary team, we had to work on the basis that it had to be an inclusive approach. So there were, in my mind, 4 factors which would make the project, the program, the idea successful. The first was to build a team which should be committed, dedicated, and courageous, because this is not for the faint-hearted. During the floods, it can be extremely dangerous. The Brahmaputra is very powerful, a huge and daunting river which can sweep away houses and cover land extremely swiftly. So I think it's very important to have that extra element of courage. The second thing is that you need a good crew. That's part of the team, but in a way separate, because the team includes your medical unit, which will deliver the services, but those who will deliver the services to those who need it are actually those who drive the boat, who are the masters, the pilots, the people who clean and cook and provide for the larger team. And I think it's very important to understand their skills in fathoming the river, seeing which way the current is going. Designing and building these boats by itself is a very difficult challenge. I remember once we started building one boat in the dry season in November. Suddenly rains came in January, February. It rained, so everything got wet and everything had to be dried. So the whole progress gets slowed. So we have to respect nature, respect the river and the people who understand it and who work on the river. These are the key elements of the challenge before us. Because unless you can do a good thing, you can make it work for 10 people. It can impact a university. But in order for an intervention like this to have the impact that you seek, it should reach at least 10 lakhs, 1 million people. Because that's just 1/3 of the population that lives on the islands of the Brahmaputra. It needs to be sustainable. How are you going to sustain such a big effort? And that's where the government comes in. We are a small entity. The Brahmaputra is a vast natural resource. We can do only so much with our resources and our staff. And of course, my colleagues in CNS thought, Saab to pagal ho gaya. He's mad. He's going around building boats when we should be researching and developing new ideas for work in governance and things like that. So I said, this is what I think we should do, and this is the way we're going to go. So that's when the government of Assam actually came forward to partner us and said that you can do so much, we will support you through the central program that's called the National, at that time, the National Rural Health Mission. And so we went from 3 districts to 5 districts, 5 districts to 8, and 8 to 13. So today, we actually work in 13 districts with 15 boat clinics. And this will give you a little of the spread of the work. What's important is that we started with a team of about 7 or 8 people. It was largely ad hoc. Today we have 250 staff, including 30 doctors and 90 nurses. This sort of work goes on every day in the 13 districts. 2 districts have two boats each because the population is large. But as I was saying, we have a staff of 250, which is a multiple growth over what existed 10 years ago. We reach 20 lakh people. We've reached 20 lakh people with healthcare. 3 lakh on an annual basis, and a large number of them pregnant women or women who've just delivered and need sustenance and care, as well as the whole process of immunization for children. Those are the priorities, and those are the critical factors for us. We are constantly facing difficult political and geographical and other situations. There's a Bandh coming up in a couple of days, I think. There are always protests over something or the other, or there are demands for something or the other. And this disrupts work, it affects work. But we still have to reach the last mile, we still have to reach the last person. Our programs are decided well in advance in a month, and the communities are informed through community workers, through the mobile sets that they have. And it's a great opportunity to connect with them and also to reach them with this basic health care.
They walk for 2 to 3 hours in dry weather and in pouring rain. As they trudge from village to village through the year, the teams are surrounded by an enduring, extraordinary beauty. It is a reminder of nature's bounty, but also of government's failure to reach the poorest with basic services.
So that's something that they do on a regular basis. They travel for 3 to 4 hours by foot. Apart from facing these other hazards and challenges I talked about, as in the monsoons as well as in the dry season. And it's a challenge that I need to be constantly aware of, because ultimately I'm responsible for this large team. It's a reminder to me of recognizing that when you save a life, you're saving a world. And it is that which continues, I think, to inspire and sustain us. I started this conversation with a story about a boat and a woman who lost her child. So I'll close it with another story of another boat and a child and a couple. Some time ago, Dhemaji is a district in North Assam. The boat clinic was coming back from 3 days' work, and it was traveling back to home base. In the evening, winters are early evenings, they could see a couple on a small island waving to them, asking them to stop. So they thought there must be a problem. So they came and they anchored the boat and came off. The doctors came off. The child was having acute respiratory distress, breathing problem. She was turning blue. Another hour, she would have probably died. But they had the equipment, they had the medicine, they had the right injection. She was saved. And the doctor was curious. He asked the father, he asked the couple, if we had come tomorrow, she wouldn't have survived. You seem to be waiting for us. And the father said something which I always remember. He said, if you go on this way, because the island is at Tri-Junction, the river bifurcates, you come back in 3 days. If you go on this way, you come back in 5. I saw you go on this way. I knew you'd be back this evening. And that to me was one of the most wonderful things and most moving things that I have heard in my life. That a stranger is given this trust of not just one life, but many lives. And it is something that inspires all of us. And I invite all of you to come and travel on these clinics with us, to visit us and see the work we do, to be perhaps inspired, but have your own inspirations and take these ideas across the world. Thank you.